Thank you for the kind introduction and for the opportunity to speak today. And thank you to Highwind for starting off the session with a great overview of generative AI tools. And now I'm excited to have the chance to dive into our recommendations that came out of the consensus process that Highwind described. And so these are my recommendations, none of which are relevant to this talk other than that I am a member of the AAD Augmented Intelligence Committee Standards Work Group and was part of the consensus process in developing these recommendations. So as we already learned about from Highwind's portion of the talk, there are numerous generative AI tools available, and you might have already used some of these yourself. And as these tools are increasingly being used in the clinical setting, we believe it's important to have guidance in place to help clinicians understand the limitations of these tools and to provide a framework for carefully evaluating these tools for clinical use. So as a great start to this, the British Association of Dermatologists and American Academy of Dermatology published this joint statement on guiding principles for use of LLMs in dermatology that was released in 2023. And this focused on safety, privacy, fairness, and generalizability. Safety, since we know that the outputs from these models may be inaccurate and potentially harmful. Privacy, considering any data entered are not secured or confidential, and fairness and generalizability, since these models can perpetuate biases. And following the consensus process Hyman described, we reached consensus on these 6 items for consideration for using generative AI in clinical practice. And this includes data, model, privacy, fairness and safety, clinical deployment, and legal liability. And I'll go into each of these items and the questions to think about when thinking through these considerations for using generative AI in clinical practice. So first being data. Garbage in, garbage out has been a long-standing saying in AI. And a study published in Nature last year in the summer showed that AI models collapse when trained on recursively generated data with just garbage as the output. And we also know from previous research that diverse data sets are important, with previously developed AI algorithms performing worse on dark skin tones. So with this information, it's important to ask questions regarding the data in terms of what data source is used to train the model, are demographics reported in the data set, and are the data diverse, inclusive, and representative of your patient population? And next, moving on to model. All of us have probably seen headlines with things like AI chatbots defeating doctors or outperforming doctors in diagnostic accuracy and passing the US medical licensing exam. But are the ways that these models being evaluated truly informative of how they might perform in the real world setting? When we looked at the literature in terms of how these LLMs were evaluated for their clinical performance, we saw a number of limitations. So they're typically evaluated with a case vignette format as how the model has presented the information. But this provides a concise summary of symptoms, so there's no evaluation of the history and gathering capabilities of these models and no evaluation of the ability to diagnose effectively during conversations, which is what happens in the real world setting. And additionally, these vignettes use medical terminology, so there's no evaluation of diagnosis in layman's language. And answer choices are provided in these multiple choice questions, so there's no evaluation of the open-ended diagnosis that happens in real life. So to address these limitations, we developed CraftMD, which is the conversational reasoning assessment framework for testing in medicine. And I'll just briefly review this to just highlight the importance of how models are evaluated and understanding what the performance that's reported behind these models mean. So in terms of the components of CraftMD, there's the clinical LLM, patient AI agent, grader AI agent, and medical expert. And how these different components interact in our evaluation framework is that the clinical LLM asks questions and interact with the patient AI agent. And the patient AI agent is the one that receives the case vignette. And the clinical asks questions, and the patient AI agent responds to these questions in layman's language based only on the case vignette. And so here's an example conversation where there's a back and forth dialogue between the patient AI agent and clinical LLM. And After the conversation, the clinical LM provides a final diagnosis. And we perform multiple types of evaluations with a greater AI agent and medical expert. And just to highlight an important finding is that when we replace the case vignettes with similar doctor-patient conversations, we see a drastic decrease in performance. So why is this important to understand? If you just look at how these models perform on multiple choice exam questions with vignette performance, or vignettes as the way that they evaluate the performance, you can be misled by a very high performance of these models. So for example, here, GPT-4 having a performance of an accuracy of 0.82. But if you change from the vignette format and instead have the dialogue as a conversation, you see a significant decrease in performance. And even further drastic decrease in performance when you remove these answer choices and instead need to have the diagnosis made in a free response format. So this is just to highlight how important it is to understand how these models were evaluated. So when looking at a model and considering it for potential clinical use, it's important to understand how the model was evaluated. And is this process of evaluation relevant to how you plan to use the model? Is the model updated over time? And how does the model incorporate new data over time as treatments and clinical practice guidelines emerge or evolve? And so now moving on to the next component, privacy. And given what we've learned from the use of digital tools and the concerns about user data and how they might be used by companies, privacy is a very important consideration. So these are some headlines with mental health apps and how they have sold user data and even conducted experiments on users without obtaining user consent. So privacy is an important consideration when using these generative AI tools. And in our study of the current state of dermatology mobile apps with AI features available to be downloaded from app stores, we also found a concerning trend where there's lack of transparency and often limited data behind what companies do with user data. So important questions to ask about privacy include if the model complies with privacy laws such as HIPAA, what measures are in place for data privacy, and how data inputs are used by the model. Is the data stored? Can the data be used for further research? Can patient information be sold? And is this an open model or a private model? And what are the implications for data privacy and sharing? And now, fairness and safety. So if we're not careful and recognizing that these models can provide inaccurate information, we may be less misled by these models. And for example, it's been shown that large language models can propagate race-based medicine. So we must be careful when we're using these tools and evaluating them and understanding that they have limitations, including providing hallucinations where they might present information in a way that's highly convincing, but is still inaccurate. And in terms of human-computer collaboration for skin cancer recognition, even dermatology experts, regardless of their years of expertise, can be misled when wrong AI predictions are provided and negatively be impacted by faulty AI. And so in terms of fairness and safety, questions to ask include understanding the biases and limitations, and if they're openly acknowledged by the model developer, what mechanisms are in place to avoid bias, and what steps have clinicians taken to verify the outputs, since we know that these models have the potential to hallucinate, and what mechanisms are in place to help avoid harming patients. And now for clinical deployment. And thinking about bringing these tools to the clinical setting, there needs to be a plan in place on how to communicate these things to your patients. So what communication plan do you plan to provide to your patients about using generative AI in the clinical setting? How will patient consent to be obtained? And do existing consent forms include utilization of AI in healthcare delivery and data collection for future AI use or development? And what infrastructure will be in place for using generative AI? For example, standards for data and prompting inputs, and how will the outputs be checked? And how will generative AI usage be documented for medical record and for proper crediting of the human AI teams? And for the last section, legal liability, we hope that these tools would help expand access and help us better take care of our patients. But what happens if patients are harmed? Who pays the bill when medical AI harms patients. And the liability concern is real. This is an evolving area with many unknowns, but through the US Department of Health and Human Services, Office of Civil Rights final rule, there's new liability for physicians who use AI-enabled technology through this final rule and the non-discrimination aspect of this rule. So in terms of questions to ask, do clinicians and the staff understand the legal ramifications of generative AI use in clinical settings? Does the clinic's malpractice carrier provide information on coverage regarding the use of AI in clinical settings? And are the legal risks addressed and reflected in patient consent forms? So as a summary for considerations of using generative AI in clinical practice, we reviewed 6 main components, including data, model, privacy, fairness and safety, clinical deployment, and legal liability. In terms of the questions to ask for each, for data, it's important to understand the data source used to train a model, and if the diversity of the data represents your patient population. For the model, it's important to understand how the model is evaluated and if this is relevant to how you plan to use the model, and if the model will be updated over time. In terms of privacy, understanding whether the model meets privacy regulations and HIPAA compliance, and what the data privacy measures are, how data can be used in terms of the inputs to the model, and whether it's an open or private model. For fairness and safety, understanding the limitations, including the biases, and having clinician verification of the output and strategies to avoid patient harm. For clinical deployment, having a plan in place to communicate with your patients about the use of generative AI in the clinical setting, including the patient consent process and pathways for deployment and documentation of use of generative AI. And also for legal liability, understanding malpractice coverage and the legal risks associated with this. So I'd like to acknowledge the AD Augmented Intelligence Committee, and I feel very grateful for the opportunity to work with all these incredible people, and I'd like to specifically acknowledge Haiwen for her incredible leadership on this project and for making this all possible. And thank you for everyone for listening and learning more about our work.